protect those who we care about most. We've assembled a panel of experts who will pick apart some of these answers.
If you don't stop the spread of this disease, any health system in the world sooner or later will fail.
So can we avoid becoming Italy? Tonight we ask, are we doing enough? So before we discuss the emergency with our panel of experts, let's bring you up to date with the latest developments. The World Health Organization has declared that Europe is now the epicenter of the global pandemic. Spain has declared a state of emergency, and some European countries are closing their borders. Here, the number of new cases has jumped by more than 200 in one day, the highest increase so far. All professional football in England, Scotland and Wales has been suspended, and May's local and mayoral elections in England have been postponed for a year. This crisis is unfolding day by day, hour by hour. But just how did we get here? News from Italy does not tend to terrify us. This week it did.
Italian outbreak of
Today's figures of
COVID-19
deaths
in the
and
Lombardy
virus
Veneto
tell
region.
us why they felt the need to act.
By Tuesday, all of Italy was in lockdown. Its iconic sites emptied. Ski resorts, schools, bars, shops, and all non-essential businesses shuttered until the end of March. Wuhan had come to Europe. This is now the epicenter of the pandemic. Rewind just 3 weeks, and not everyone in Italy seemed convinced by the virus's reach.
Ma perché ci sono gli scaffali della pasta vuoti? Ma che cosa sta succedendo? Manco quando è scoppiata la seconda guerra mondiale c'era stato un panico così.
Today, doctors in Lombardy are hoping that they have enough ventilators for those that need them. These images are all too reminiscent of the quarantined Chinese city of Wuhan. But when the same images come out of Milan, it suddenly all feels very real and far too close. We here in Britain are about to face some very tough choices indeed. While the stock market may have experienced some record falls, most of us have carried on living our normal lives as per usual, going to the pub, taking our kids to school, going to the office, taking the tube. Is all that about to change? And is Italy under lockdown going to be our new normal? Look at a map, and the growing number of cases in Italy, Spain, France and Germany makes you feel like it's closing in. And an analysis of infection rates suggests that we may not be far behind Italy, which has over 15,000 cases and over 1,000 deaths. Other countries appear to be on the same trajectory, with Germany, France and Spain roughly 9 days behind Italy, the US around 11 days, and Switzerland 13 and the UK 14. So far, the government has been trying to contain the virus by testing and isolating those infected. But society still continues to gather and schools remain open. The government has hinted all that may change. In order to delay the epidemic's peak and prevent the NHS becoming inundated with cases, the Prime Minister has asked anyone with a cough or high temperature to stay at home for 7 days, with more measures to come later.
At some point in the next few weeks, we are likely to go further, and if someone in a household has those symptoms, we will be asking everyone in that household to stay at home.
The underlying message: it's not if life was from Europe, but not the UK and Ireland.
The European Union failed to take the same precautions and restrict travel from China and other hotspots. As a result, a large number of new clusters in the United States were seeded by travelers from Europe.
China appears to be coming out of the crisis. It has seen over 80,000 confirmed cases and over 3,000 deaths. A combination of locking down cities, contact tracing and social distancing, like staying at home, closing schools and banning mass gatherings, appear to be slowing the virus. And new research suggests it could have been a lot worse. It's now estimated that the true number of cases in China is in fact closer to 115,000. And had authorities not intervened, there could have been 67 times more cases. That's over 7.5 million people. Researchers believe if China had acted 3 weeks earlier, the number of cases could have been reduced by 95%. China's response has earned praise from the World Health Organization. And with the pandemic now declared, it's expressed guarded criticism towards those who don't act decisively.
We have called every day for countries to take urgent and aggressive action. We have rang the alarm bell loud and clear.
Despite being urged to act, Britain's experts believe that taking action too early could actually do more harm than good. None of us can ever remember a crisis quite like this one. We are watching life as we know it grind to a halt. Our hands have become potentially our worst enemies. Hugs are out, coughs terrify, and all the while we wonder, what's next? Who's next? Well, if the public is trying to work out what this crisis means for them, how about hearing from the experts? In this special program, we'll talk to the scientists, economists, and those on the medical front line about what we can all do to keep safe and ask whether it's enough. And just what will the impact of the virus be on our society, our economy, indeed our psyche? But the question on everyone's mind right now is whether the government's perhaps cautious approach is the right one. I put that to Professor Nick Finn, Deputy Director of Public Health England's National Infection Service. And I asked him whether the approach is to allow some people to get infected to develop what's called a herd immunity.
Well, herd immunity is the situation where you get so many people in the population that develop an immunity to a disease that there is no opportunity for the disease actually to become established and spread to lots of people. Normally we do that with a vaccine, so we'd vaccinate everyone so that anyone who was infectious and came into contact with someone who'd been vaccinated, the disease wouldn't travel any further. You can do that naturally, of course, if a disease that's not been introduced before affects a large number of people, and that's really how herd immunity in the UK would develop.
Right, so is that now the policy, to allow the infection to spread, perhaps in a controlled way, to a large section of the population so that we develop that immunity in a natural way?
No. We're not advocating that at all. This is a process of delay. So what we're saying is that people who have symptoms should stay at home for 7 days. And at the end of the 7 days, we take the view that they're not likely to be infectious, and therefore they won't pass on the virus.
But slightly mixed messages here, because we have heard from the government that they do want to build up herd immunity. So which one is it? Are we going for herd immunity or not?
We're going for a tactic which we call delay, which is trying to slow the progress of the virus within the UK. And by doing that, it becomes more manageable. We don't see a very large peak where the NHS could well be overwhelmed. It's in a sense flattening the epidemic curve.
But is there not a danger that in the pursuit of that solution, you're going to turn especially the more vulnerable members of society effectively into guinea pigs for what works?
No, the key issue here is that we are following the science. We're trying to contain the spread of the virus by asking anyone who develops symptoms to stay at home for 7 days, and at the end of that time they would be no longer considered infectious.
Professor Nick Finn speaking to me earlier. Well, joining me now is John Edmonds, Professor of Epidemiology at the London School of Hygiene and Tropical Medicine. He works on the mapping of infectious diseases and is currently advising the government on the coronavirus. And from California is Silicon Valley executive and writer Thomas Pueyo. He's not a scientist, but his detailed modeling of the virus's spread